My name is Ketigian. I'm a third-year medical student from NYTCOM, and my presentation is Females with Young Onset Parkinson's Disease, a Forgotten Demographic, and Investigational Inquiry of Health and Social Factors. Parkinson's disease is a neurodegenerative disease resulting from loss of dopaminergic cells in the basal ganglia. It presents with motor symptoms as well as non-motor symptoms. Men are 1.5 times more likely than women to be diagnosed with PD, with prevalence favoring the older adult. When PD is diagnosed between the ages of 21 and 50 years, however, it is known as young onset Parkinson's disease. Women diagnosed with YOPD therefore make up a much smaller cohort than the typical PD patient. YOPD women often present quite differently and consequently are vastly underrepresented in the literature. There is some evidence that genetics and gender discrepancies play a role in disease onset and progression, but further research is required to strengthen existing correlations and discover new associations. Osteopathic philosophy focuses on treating the entire person, not just the disease. Therefore, our research aims for this study are to investigate potential correlations of YOPD with patient history, as well as to consider the entire mind, body, and spirit of women with YOPD to improve diagnosis and management of these women. This is an observational cross-sectional survey study. 39 females were recruited from the Young Women's Patient Education Virtual Forum held through NYTCOM on May 28, 2020. Inclusion criteria included females with a diagnosis of YOPD between the ages of 21 and 50 of any Hone and Yar stage. Participants were sent a custom-made online survey via RedCap with the incentive of receiving a $25 TD Bank gift card after survey completion. The survey was estimated to take approximately 20 to 30 minutes and included questions inquiring about demographics, PD progression, medications, and medical, social, and family history. Descriptive statistics were analyzed. The Young Women's Patient Education Virtual Forum was held over Zoom this past spring. It allowed women with YOPD from all over the world to connect with each other and with health professionals. Guest speakers included Kathleen Kiddo, a blogger and actress with YOPD who spoke on acceptance, dating, and living with PD as a young woman. Maureen McGrath, RN, spoke on sex and intimacy and PD from the woman's perspective, while Heather Zwicky, PhD, spoke on neuroinflammation, endocrine system, and nutrition. Interactive Q&A sessions followed each speaker. At the end of the forum, women were put into smaller breakout rooms to connect on a more personal level, exchange information, and discuss the day's events. After the forum, women who met inclusion criteria were sent an email explaining our study, giving informed consent, and with a link to the RedCap survey. A total of 26 women responded to our survey, producing a response rate of 66.7%. Of the respondents, 73% were Caucasian with a mean age of 48.7 years and mean age at YOPD diagnosis of 41.8 years, ranging from as young as 27 to up to 50 years old. The first outcome we chose to look at was symptomatology and PD progression. We asked the women about the most common symptoms they presented with that diagnosis versus the most common symptoms they present with now to investigate how their symptoms have changed over time. These symptoms are broken down into motor, non-motor, and neuropsychiatric symptoms. At diagnosis, the most common motor symptoms were tremor at 85%, stiffness 62%, and poor handwriting at 46%, which is in contrast to the current most common motor symptoms, which are tremor and stiffness, as well as rigidity and bradykinesia. The most common non-motor symptoms at diagnosis included fatigue, pain, aches, tingling, cramps, sleep problems, and constipation, all of which remain the most common non-motor symptoms presently, with a substantial increase in women reporting these symptoms, most notably sleep problems. Anxiety, depression, and apathy were all reported as the most common neuropsychiatric symptoms at diagnosis and have remained the most common symptoms currently, with apathy increasing about 30%. Next, we investigated patient history. Regarding health history, 31% of women reported a history of iron deficiency anemia, which we asked about specifically due to the potential relationship described in the literature between low iron levels and earlier onset of PD in women. 0% of women in our study have a diagnosis of any kind of cancer. 92% currently take some form of PD medication to manage their disease. Most common family history included PD, both young onset at 35% and late onset, breast cancer, and heart disease. Sleep disturbance is common in these women, with 46% reporting difficulty falling asleep, 58% difficulty staying asleep, and 42% difficulty with daytime sleepiness. Overall, 46% reported decreased duration of sleep, with an average of 7 hours of sleep per night before diagnosis of YOPD, reduced to an average of 5.2 hours of sleep after diagnosis. 81% drink caffeine and 85% exercise regularly, both of which are known to be protective against PD. Lastly, we wanted to look at specifically women's health in relation to YOPD. Regarding obstetric, gynecologic, and sexual history, the average age of first menses in these women was at 13 years. 46% report having used contraceptives at some point in their lives. 46% report new or worsening of their PD symptoms during menstruation. This may suggest a potential need for medication adjustment throughout their menstrual cycle. 81% report changes in libido and sexual function since their diagnosis. 27% report a history of emotional and or sexual abuse in the past. 81% of these women have been pregnant at least once, half of whom have had at least one C-section, and half of whom have had at least one miscarriage, abortion, or stillbirth, with some women reporting up to 4 pregnancy losses. To our knowledge, this is the first study of its kind. Based on our survey, YOPD females present with different symptomatology throughout their disease process. Recognizing the most common symptoms at the start of YOPD can help with faster and more accurate diagnosis and an understanding of how these symptoms may change over time for proper management. Singularly female manifestations suggest possible hormonal associations. Estrogen is thought to be neuroprotective against PD, so those with hormonal imbalances may be at higher risk. Understanding these manifestations may be imperative to recognizing risk factors in females and better pharmacologic and non-pharmacologic management. All of this information takes into account the entire woman, her history, and her disease, rather than treating this disease as a one-size-fits-all. Limitations of this study include lack of racial diversity and small sample size, although the study is currently ongoing. Future directions include collecting biomarkers such as found in saliva and investigating temporal associations of symptoms and PD onset with medical and social history, as well as the inclusion of women from different racial backgrounds. Thank you so much for listening. Please feel free to reach out with any questions.